The Philippines is a developing country. And although we have been battling poverty for so many years now, there is no denying that life in the country is still poor compared to other countries. As a matter of fact, more than 16% of the Philippine population still lives below the poverty line. According to reports, out of 90 million Filipinos, many do not get the same access to basic health care. The World Health Organization believes that there is a history of unjust access to health services in the country that significantly affects the poor. According to them, the government spends little money on health programs, which cause high out-of-pocket spending that further widens the gap between the rich and the poor. Besides poverty, shortage of human resources make the system run slower. The government has made measures to amend these issues. However, it isn't enough. So now, the problem has become more pronounced as private and government hospitals continue to struggle in offering healthcare services. In fact, since the start of the pandemic, hospitals have been challenged on how they can handle the surge of cases of positive COVID-19 patients. The Philippines had been suffering for years now, when it could have been prevented from the beginning. The Philippines was never ready to deal with the COVID-19 pandemic. It is obvious because even before the pandemic, there had already been struggles when it comes to other aspects of the medical field. Lagipo in 2021 presented a peer-reviewed study from the World Health Organization discussing that the country lacked organizational preparedness. Reports show that there are an estimated 10 hospital beds and 6 doctors per 10,000 people, which, taken together, amounts to only 2,335 critical beds nationwide. Healthcare resources are centralized only in urban places, leaving rural areas lacking available physicians. Research shows that in every 20,000 people, only one physician is available. Besides the problems with the healthcare facilities, there are also demands for salary increase and health worker benefits that haven't been given enough by this present administration. Magsambol in 2021 reported that while the country deals with the surge of infections of the new variants, healthcare workers continue to suffer not only from poor working conditions but also from delayed benefits. There were actions implemented by the government due to the nurses' threats to resign and strike warnings. Aside from poverty and lack of healthcare workers, corruption had always been an issue in the Philippines. It is very disturbing that while our country hit rock bottom, 67 billion pesos worth of COVID-19 funds were used poorly according to the Department of Health audit reports. The demands of the people are loud, especially the demand for betterment in these trying times. If we compare the Philippine healthcare system from years ago to this one we enjoy at the present, we indeed have it so much better. But still, due to the circumstances that we face today, we should not settle for this. It is just the bare minimum that many Filipinos are still not privileged to have access to. This situation should teach us a lesson as to why an efficient and effective healthcare system matters. It should be improved and made flexible so that the country would be prepared for the surges of pandemic and other health threats. As the old saying goes, health is wealth. Improving the healthcare system would not only protect the health of our people, but would also make them productive in the community, giving a domino effect of positive implications to other fields as well. May we realize that this is the right time to call for action, to change the healthcare system into something we all deserve. Ah, fuck.